Hi, I'm Marilyn. I'm a physician assistant. I serve as a Foreign Service medical provider. Well, on a daily basis, it's not much different than what you do as far as patient care in the private sector. You're seeing patients for acute and chronic illnesses in a family practice setting. The difference is you may not have the volume of patients that you would see in the private sector. The other difference is administratively you're doing a lot more, where you had a huge support team in the States. You know, you had an office manager and nurses and somebody, doing the scheduling. You're doing all of it, soup to nuts. You're managing the health unit, providing primary care, making sure folks that need to be hospitalized are getting the best care that you can find in that country until you can move them to a higher level of care. So it has its similarities, but it certainly has its unique challenges. The environments are very austere. The thing I love the most about my job is the camaraderie and the ability to meet physicians in our local countries that help us take care of our patients. When they see that we all have the same goal, is to take great care of our patients, I find it much easier to work within their systems. So when they realize that's what you're there for, you're not there to critique them, you're there to seek their services, I find that it's been phenomenal. I would say professionally the greatest impact has been my ability to provide quality care in challenging situations. That I knew that things would be foreign, and that I was able to seek out the resources I needed. One thing as a physician assistant, I know what I know and I know what I don't know. And I made sure that I surrounded myself with local providers that could provide the care to augment the care that I was providing. So to find that best surgeon, to find that best cardiologist, and network within the local community the best that I can. Professionally and personally, one of the most fulfilling was when my husband and I were in a grocery store in Bulgaria, and one of the local docs stopped me at the checkout and greeted me and asked how things were, and my husband turned and he said, "You truly are in the community. This is like home," where you always knew everybody. Whenever we went to the grocery store, we couldn't get through without a patient stopping you or another one of your colleagues. And so I felt that I was had reached my goal of really becoming part of their community as well. The 12 years in the Foreign Service has just been incredible. And again, it's back to what I had referenced before, this opportunity to provide medical care and service to our American diplomats, serving in these very austere environments, having the opportunity to interact with other medical systems, appreciating the differences, learning from them.